The biggest problem with antidepressants and many psychiatric medications is the actual research supporting the use of psychiatric medications is just terrible. None of these medications have been studied any longer than a year.
That's so powerful, Josef.
What the hell is happening to these people?
Dr. Josef Witt-Doerring is a board-certified psychiatrist with a specialization in identifying and treating psychiatric adverse drug reactions.
His prior experience as a medical officer in the Division of Psychiatry at the Food and Drug Administration gave him a unique perspective on the risks and benefits of psychiatric interventions in both the short and long term.
There's clearly a commercial incentive from drug companies. To the extent possible by the law, they will overhype the benefits and minimize the risks. If you do ask the questions, then you're a dangerous person and you're scaring people away from the drugs.
You're referring to these medications as performance enhancers.
The main story is just that the drugs don't work. And you've effectively robbed that person of the opportunity to fix their life.
Wow, that's incredible. That's like, can I stand up and clap?
They deserve to know the truth and they deserve to know what they're walking into.
Welcome to Prescribing the Truth. I'm Dr. Nicole Morris, a Catholic naturopathic doctor and natural fertility expert. Around here, we don't just accept the mainstream narrative, we question it. My goal with every episode is to share the love of Jesus with you and empower you to make informed, confident decisions for you and your family. So grab a cup of tea, get comfy, maybe even throw on your tin hat, and let's dive in. Welcome to Prescribing the Truth. I'm thrilled to have all of you here with me today, and even more thrilled to have my colleague, my friend, Dr. Josef, the CEO and founder of the Taper Clinic, here with me today to talk about all of the psychiatric drugs and all of the ways that they influence our bodies and how to support our clients and patients in getting off of these medications. And we're just going to kind of dive in head first. So I hope you all can pull up a chair and a cup of tea and really dive into this conversation with us. So thanks for being here, Dr. Josef.
So happy to be here with you, Nicole.
So let's dive in. Tell us a little bit more about you, what you do, and then we'll take it from there.
Sure. So I'm a psychiatrist. I'm a medical doctor that specializes in using psychiatric medications, but I'm not like other psychiatrists. And the reason for that is I actually take people off psychiatric medications. And there's a bit of a backstory to that, which I know you know, Nick, but I know your audience doesn't. So the reason that I take people off these medications is because early on in my training, I noticed that they really don't fix the reasons why people get, why people are having problems. They really just mask them. And I would ask a lot of these questions during my training, and I would get these looks from my professors like, haven't you got the memo, Josef? We don't ask these questions. The drugs are safe and effective. The FDA says so. And I knew it wasn't the case because I was like, how does it make sense that you could fix anxiety and depression in a 20-minute visit where you're not even taking the time to understand the problems going on with people? It was a big no-no, so you're not allowed to ask questions like that in establishment psychiatry. And so I ended up becoming a drug safety researcher because I was like, something is off with this. And I really like psychiatric clinical trial research. And so I went and worked for Janssen Pharmaceuticals, which is the largest manufacturer of new psychiatric medications. And then I went to the FDA and I was a drug regulator in the Division of Psychiatry, reviewing safety issues for the agency and also reviewing clinical trial data to let drugs on the market. And the long story short of it was that when I actually got behind the scenes and saw how the sausage was made, I realized that the actual research supporting the use of psychiatric medications is just terrible. I mean, it just like if you just blow wind at it, it falls down like a house of cards. And so that was really concerning. And I was also learning at that time that many people were told that it was going to be easy to come off these medications, and it just wasn't. About 5 years ago, I started the Taper Clinic with my wife, who's also a psychiatrist, to address this problem, that people were sold a fake bill of goods about what these medications did, and they were not warned about the problems and how hard they could be to come off. And so me and my wife have been running this practice for the last 5 years, helping people come off. So that's my story. That's how I came to do this.
And we are so incredibly grateful for the work that the two of you do. And supporting these patients at the capacity and level that you do is really not an easy journey for them, but a life-changing journey for them, most certainly. I'm curious, in your training, was there a particular situation or a particular patient story that really struck you and made you feel like, wow, we need to do this differently, and really inspired you to start the Taper Clinic?
Gosh, I mean, I can think of a couple anecdotes, but the main story is just that the drugs don't work. And I mean, it's obvious once you do it for enough time. People, you don't just put someone on 50 milligrams of Zoloft and they sail off into the distance and they're fine. I mean, that person's inevitably back in 6 to 18 months needing a higher dose because the drugs cause tolerance and the effects wear off. And so I'm just watching these patients accumulate drugs over time. I mean, some people were even getting worse. I remember I did a rotation in the Harris County jail, and there was a guy there who got put on an antidepressant and was saying, I feel like this is making me worse. I feel more suicidal. And I remember him telling the jail psychiatrist that this was going on. And she looked at him and was just like, don't be silly. These drugs fix depression. They don't make it worse. Completely oblivious to the fact that some people can actually become worse on these medications. And so I also got to see some gaslighting as well, where, in the eyes of, I think, a lot of, I would say, the more mainstream and the ones that haven't really woken up yet, in the eyes of those people, they see these drugs as almost infallible. They're fine, safe and effective. They could never cause problems. And guys, we were taking drugs that disturb our neurotransmitter systems. It's not going to be predictable for everyone. And so there was all of these different things that I was seeing. I was just like, it just doesn't make sense.
Right. What would you say are some of the biggest side effects or red flags that you see in your patients that people that may be listening that are taking these psychiatric drugs, may be red flags to them to allow them to stop and think like, oh, maybe these pharmaceuticals are making me worse and not better? What are some of those things that you see?
So let's talk about the antidepressants. And I'm going to take a different approach to this. I know, you might ask that and expect to hear like a list of things on the drug label. Sure. But to me, the biggest risk isn't actually, that they can make some people suicidal. I mean, that's a risk. They cause a lot of sexual dysfunction. They can cause some weight gain. Some people become manic in rare cases, and they can get a bipolar diagnosis. The biggest problem with antidepressants and many psychiatric medications is how they make you see yourself. And so oftentimes when you go in and you get a diagnosis from a doctor, they might spend 20 minutes asking you about your life, and they say, okay, well, or if that, they just ask you about your symptoms, and then they give you a diagnosis. And at least if you're in the United States, and I think most of the Western world, it's very transactional, and all of a sudden you get given a script. The doctor may even tell you have a chemical imbalance, or they may just say, we don't really know why depression happens, but we know these drugs are safe and effective, and I guess it's biological in some people. And so people will take that and they'll walk away thinking that there's something wrong with them. And you've effectively robbed that person of the opportunity to fix their life if you've confused them in that way. Because many people are unhappy because of totally legitimate reasons that are well understood, whether it's relationship problems, whether it's existential issues with their career, whether they're eating really terrible food and they're physically unhealthy. If someone is having, these symptoms because of those reasons, and then you tell them, you have a brain illness and go ahead, take this drug that's going to mask them, because that's all the drugs do, the problem just festers in the background. And then, they're on the drugs, they become tolerant to them, they start accumulating them. Eventually, when the side effects get too much or they realize they've been sold a false bill of goods, all of those original problems are waiting for them, along with a nasty withdrawal as well. And so that, to me, is the biggest and the most common risk of taking the medications.
Wow, that's incredible. That's like, can I stand up and clap? To reiterate what you said, like that's so powerful, Josef. The biggest risk is how they make people see themselves in their experience. If you just think about that for a minute, like there's so much power in that, right? How many of these people are being medicated that don't actually need to be medicated? There's a root cause, right? And that's why we all do what we're doing in this alternative space of medicine, if you will, is helping our clients and patients find the root cause. And so what I think I'm hearing you say is we're not finding the root cause when we're using psychiatric medications. We're just covering it up or suppressing it even worse and sending them on with their life in a 20-minute conversation. Yeah, and this is very apparent to people if they just think about their interaction with their family medicine doctor or psychiatrist. This person hasn't spent that much time with them. I want to add something in here because I know, we work in the alternative med space, and maybe our audience is like, yeah, I get this.
But for someone out there who's listening, who might be a bit more skeptical, like, who is this guy who's saying these things about these medications that everyone, I know is telling me that they're safe and effective. Every single doctor has said this. I see this online, on TikTok, and all these places. Is he wearing a tin hat? I want people to know this. None of these medications have been studied any longer than a year. There's never been a controlled trial that has pitted people on the drugs against a group of people off the drugs that has lasted longer than a year. Now, just think about that for a second. This would be very important for drugs that clearly cause tolerance and wear off over time. It would also be very important for drugs that are muting your emotions, and you would want to say, well, what's the collateral damage of that? How does that affect relationships and drive and work and meaning and purpose? Maybe we should look at these things over several years to see if we're noticing any changes. No, it has never been studied, not once. And 50% of Americans are on these drugs for over 5 years. So it's essentially like a dice roll. And that's the part that people don't hear. The doctors will say, don't worry, the drugs are safe and effective. Well, the part they leave out is, for the 3 months that they did that clinical trial, they're safe and effective. What the hell is happening to these people, over years and decades?
Sure. And I think that is unfortunately such a common theme in the pharmaceutical world, right? Is these clinical trials are often short and not long-term. And to your point, patients are usually on these medications for longer durations of time than they're even indicated. So that's powerful. What influence do you feel that the pharmaceuticals have played in shaping how we culturally believe about these medications or how providers are using them?
They've played a huge role, and it's not just in psychiatry, it's in all of medicine. I'll try and lay it out, but it's quite intuitive, and it's what you would imagine would happen if you have one group of people who have billions of dollars in marketing spend and a war chest of resources. So misrepresenting what these drugs do, and because that's what it is. There's clearly a commercial incentive from drug companies to the extent, possible by the law, they will overhype the benefits and minimize the risks, because that's what leads to drug sales, right? I think that doesn't really surprise people too much, but they expect that there's a counterbalance to this. And they'd say, yes, sure, drug companies are biased, they want to sell drugs, but I get my medical care at Stanford or Harvard or Yale, or I go to these great institutions where there's these nice doctors in white coats and they're professionals, and they say the drugs are safe. I think the thing that people miss is just how insidious this influence is. One of the things that has happened with the pharmaceutical industry is that they've corrupted academia. Because one of the best ways to become a professor in a big academic institution, the places that are meant to protect us against this bias, one of the best things that you can do is run clinical trials for drug companies, especially in psychiatry. If you look at the major psychiatrists, they all run clinical trials because the drug companies, they help them publish papers, they fly them around the world, it pads their CV, they're seen as experts in the field. And so there's this careerism that happens where if you go along with the message of the drug companies, if you shy away from criticizing things, if you overhype the benefits, you will do better. You will ascend the ranks. And that's essentially what we see in psychiatry now. We have a whole upper echelon of psychiatrists at these institutions who are very drug friendly because of their career. And they've taken over the narrative. And the narrative is one where these drugs are safe and effective. They're fine. Don't ask too many questions. And if you do ask the questions, then you're a dangerous person and you're scaring people away from the drugs. And, you're really the most despicable type of, human being out there. I mean, that is kind of the message. And it's exactly what happened with COVID.
And you're at risk of losing your medical license, right?
Yeah. And you're at risk of losing your medical license. Yeah. And they try and cancel you. But I tell you what, Nicole, we are in one of the best times in American history because Bobby Kennedy Jr. is in there. Jay Bhattacharya, of all people, is now running the NIH. And so take that, all you people out there, you COVID people. I mean, it's changing. The public is now waking up and they're seeing the corruption. And it goes on and on. I mean, medical journals have also just become this essentially marketing for drug companies. But there's a shift, especially in America right now, towards more transparency. transparency about these things, and people are waking up. So it's very good.
And we know how much medical research is suppressed and retracted and doesn't fall in alignment with the narrative, right? And so therefore the people don't see it, which is unfortunate. But what a time to be alive here, right? The time is now. I think that we're both in agreement on this, but we're like on the brink of a revival in medicine. I truly believe that. And I truly believe it's because that's what the people want. And that's what we have stood firm in and essentially have demanded. And that's the moms, I believe, right? That's the moms standing up and saying like, no more, like we're not tolerating this anymore. We're going to protect our children. We could have a whole other conversation, I'm sure, on psychiatric medications just in children and the number of children that are medicated. Actually, I'd love to get your opinion on that. Let's talk about that for a minute. Like, what do you think about all of these kids who are diagnosed ADD, ADHD, medicated to go to school? What are your thoughts on that?
I'm glad you asked me about that because I do want to talk about it. I think there is a cultural sickness in the Western world, particularly in the US, when it comes to ADHD. So I'm not saying that there aren't some children who have a harder time focusing on things, who are more restless and irritable at times, kids that do better at focusing and those who struggle. But we definitely have put a social currency, on children who can sit still in the classroom, are well behaved, and can work behind a computer and do what they're told. And and I think in many ways that's because the US is very competitive culturally. It's like you become a doctor or a lawyer or someone in finance or an engineer, and you'll do fine. If you go into something else, you're a loser. And I think that parents really feel this pressure and children really feel this pressure, and they start to use stimulants as performance enhancing. And so, the recent data that I found was that, and this was in New York Times Magazine. This is not, some fringe outlet. What they found with the ADHD diagnoses is that 17% of, I think it was like boys who are like 14 to 17, something like that, are diagnosed with ADHD. That's like the stupidest thing I've ever heard. 17% of our adolescent males don't have a brain disorder. These are kids who are feeling pressured to use these medications for performance enhancement, and the parents are as well. And it's an awful thing because essentially you're setting someone up to do work that they can only do on drugs. And this is what I cover on my YouTube channel. I just talked to a guy, Cooper Davies, recently. He got on ADHD medications as a teen so he could improve his performance. He ended up becoming a journalist. He got a whole bunch of side effects and eventually came off 17 years later in his 30s. And he realized that he hated his job. It was the wrong job. He had built a life that he could only live while being drugged. And now he's kind of putting it back together. And it would have been just so much better to find something that you don't need to be on drugs to do. And so I think, the use of ADHD medication is, it's out of control. I think it's a cultural thing. And I think that we need to support parents in helping them find things that their children can do in a non-drugged state, because that's going to be more sustainable in the long run.
Absolutely. And I want to repeat something that you said because I've never thought of it this way, and I'm guessing that a lot of parents haven't either. But you're referring to these medications as performance enhancers, and that is 100% what these are, right? We are medicating children to put them in a classroom to make them perform better to a set of standards set by our society that is truly outlandish to put an 8-year-old boy in a classroom and expect him to sit in his seat and be quiet and listen and do his work for 8 hours a day. Our classrooms are not set up to support these children. So again, it's like going to the root cause. What is the issue? Is the issue that your child is not performing well enough in government standards, or is the issue that the child's in an environment where they don't belong, right?
I want to add a tweak to that because
Please.
I think I may have misspoke when I said performance enhancing. These are behavioral controls. So with ADHD medications, there has never been, the data, the long-term data does not show that it improves academic performance, which is the thing that most parents care about. So in the short term, being on stimulants and then sitting an exam, it does not improve performance compared to the unmedicated kids. Long term, it does not improve outcomes. It just feels like it to them. And so stimulants can make boring tasks seem more interesting. It can make hyperactive children more docile and still and focused. It's not actually helping. And I would say that these drugs are actually counter to improving performance for most people. Now, I want to have a bit of nuance. Like, so if you had a lot of anxiety and you got on a medication and it brought that down, and in conjunction with that, you were really looking at your life and you had a great therapist and you were able to work on improving your life, maybe there is a place for it there. But what happens to a lot of people is, rather than it being performance enhancing, I mean, you're anxious about your job or your relationship. You drug the feelings away. You stay in a relationship you're not happy with. You're lonely. Instead of getting the drive to go and fix that loneliness, you kind of just say, oh, I'll numb it out. Instead of going and working a job that you actually like, you say, well, I guess I can do this if I'm on SSRIs. This is fine. These aren't performance enhancing drugs. These are things that help people cope with sadness that really does mean something and deserves real legitimate answers.
Yeah. And ultimately at the end of the day, it just describes and shows how broken our system is, right? These humans, they're people, right? Not getting the support that they need to thrive in life, where with some simple changes, their situation could look entirely different. Instead, they're being medicated for the next 5, 10, 15 years until they've had enough.
Yeah. And it's not the care you'd want for anyone that you loved. Yeah.
Exactly. Yeah, exactly.
Mm-hmm.
Today's episode is brought to you by the Fertility Formula Masterclass. My team and I have helped hundreds of married couples conceive naturally without IUI or IVF. If you're struggling to get pregnant or stay pregnant and have been told there are no other options, don't stop searching. There is hope, and finding the root cause is key. If you want to learn more about how we can support you on your journey to motherhood, head over to drnicole.morris.com, and don't forget, Nicole has an H in it. All right, let's get back to the show.
Talk to me a little bit about informed consent in psychiatry. What does that look like? Do you believe informed consent, enough information is given for patients to give full informed consent? And what would that look like for you?
No, it's, I would say informed consent does not exist in psychiatry or in many areas in medicine. And it's a huge gap in our care. I mean, most people who get on SSRIs get told, oh, you might have a bit of nausea at the start, and if you're feeling a little bit jittery, that's okay as well. But they're safe and effective. Don't worry. If it's a kid, the parents might be told, watch out for behavioral changes. Bring them back if you notice anything off. Some people don't even hear that, and then when you go to the pharmacist, they slide I know if I'm at the Walmart, they slide this little electronic reader at me and they just go, oh, can you hit the buttons? And one of them says you've been given an opportunity to ask the pharmacist questions and you don't even know what you're clicking. And so the doctors don't really tell people what's going on with the drugs. The pharmacist doesn't. They put a piece of paper inside the bag and they just go, oh, well, I guess the patient will read it. But the patient is thinking, I mean, this is complicated and long. My doctor would have told me everything that's important because they actually care about me. So informed consent does not actually exist. The other issue is that many doctors have been completely misled about the safety of the medications. They also think, these mental health problems are, biologically based and they need to be fixed with drugs because that's how they were trained. And most people don't know what they're getting into. And I worry a lot about your audience, Nicole, because you help women who are wanting to conceive naturally. And I feel like women are not told anything about the risks of these medications and how it intersects with pregnancy and having children, and it's awful.
Yeah, let's talk a little bit more about that. I have clients come into my program on occasion that are on different medications. Right, I can think of one right now who came in on Effexor, and her prolactin levels are high, and we know when prolactin levels are high, that can suppress ovulation. Well, it's hard to get pregnant if you're not ovulating, right? It's kind of a necessary step. So we've been supporting her in talking about, the importance of working with her prescriber to taper off of the Effexor and what that looks like. But, her frustration really comes from never being told that it has any influence on her fertility or her hormones. And I think that's probably a common sentiment for a lot of those that are listening, and a lot of women are on similar classes of medications, right? To kind of cope through life. Can you talk to us a little bit more about some of the things that those struggling to conceive should really be aware of in terms of these medications if they're on them?
Sure. Yeah. I want to talk about some stats on this quickly, because
Please.
This is a really common problem. So between 6% and 13% of pregnant women in the US are on antidepressants right now. That's about double what we see in the rest of the world. So our pregnant women in the US take almost double the amount of antidepressants.
Mm-hmm.
And on top of that, around 15% of women of childbearing potential, so, usually between, let's say 15 and all the way up to, 44, something like that, they are on antidepressants as well. Half of those pregnancies are not planned. That's some stats that I want people to be aware of. This is a common issue. Lots of pregnant women are on these medications, and many of them are conceiving knowingly or unknowingly. Probably the biggest thing that bothers me about this is that many women are told, they're safe during pregnancy. It's essentially what they're told. These are safe during pregnancy. There's no data out there that supports this. It's simply not the case. I mean, it is a huge lie. This is going to be something that's going to be blown open. Let me show you what studies have found, because it's quite disturbing. The first thing I want to talk about is that our serotonin system is really important to the way, we think, and our mood and our emotions. I mean, I think most people know that to be true, and taking these medications has a profound effect on our serotonin system. And when you are going from, 2 cells to a fully formed human in 40 weeks, there is a huge amount of neurological maturation, and your CNS is changing. And if you are introducing a chemical, because all of these things cross into the placenta, if you're introducing a chemical during that time, you're going to cause changes in brain development. What is there to support this? Well, there have been so many animal studies now. I mean, there's systematic reviews on animal studies where they get mice and rats who, in utero or in the early days of the life of the rat, they start to get exposed to antidepressants, and they are then stopped. They then compare the offspring of those rats and mice to the offspring of unmedicated rats and mice, and they see higher rates of autistic-like behavior, decreased sexual activity, and so that they're actually seeing behavioral changes in the mice. And I know you might be saying, well, Josef, that's just mice. Who knows what happens in children? Can you really say that's something to be concerned of? I mean, me personally, if I saw that in mice already, I'd say, well, that's enough for me to be concerned about. But we have over 11 MRI studies, functional MRI studies, that look at human babies, and they have controlled groups where they have, the babies whose mothers were on these medications and the babies who weren't. And there are changes in the gray matter volume in the brain, in different parts of the brain. There are actual changes in humans. And this is also backed up in some of the epidemiological studies, like observational studies and such. Now, the reason no one says that there's a risk is because there's some prominent scientists out there who will say, well, we don't see it in the big database studies. And there's so many problems with the evidence in the big database studies.
Sure.
There's different types of confounding, and they try and say just dismiss it, kind of like they try and dismiss the link between, cigarettes and cancer for a long time. But if you look at it in the totality of the evidence about what's happening in the animals, what the brain scans are showing in these studies of kids who were on these while they were growing up and the kids who weren't. And if you look at it all together, I think there's a strong signal that there are effects on the brain. And so how does this end up playing out? Well, it ends up playing out with higher rates of autism-like behaviors, higher rates of things like ADHD, and even depression as well. It's incredibly hard to know what these effects are. We know that they're happening. We're seeing them in the brain. We've seen them in mice, but we don't really know what this is doing to humans. Now, I want to be careful here because this is not, there's a lot of children out there who are born on these medications. My colleagues have children who have been born on medications, and they're lovely and they're doing great. But it still worries me that it's what is going on here? This is what kind of changes have taken place that we're not aware of. Women aren't being told this by their doctors.
No,
and so they're not being told these risks that you can have neurodevelopmental problems, And, that there's quite strong evidence. The other thing that they're not being told, which I think is happening to your patient right now who is on Effexor, is that, hey, this is going to be a pain to come off later on. Like if you're getting on this when you're 19 and maybe you wake up at around 30 and you say, I want to have children. Sure, some people can come off pretty quickly, but many people can't. It ends up taking them 1 to 2 years to do a slow taper. And you've just lost 2 years of this, this period in your life where you want to, before age 35, where it becomes more complicated, where you have to go through this thing. And so I think women are lulled into this false sense of security. They're told by the doctor, they're told by people on TikTok who are just like, oh, it's no big deal, everyone takes them. And then they wake up and, they're like, oh, I have to go through withdrawal and I have to be worried about, potential effects on my child.
Yeah. And ultimately it goes back to being an easy fix, right? So in your scenario where it's a 19-year-old going on these antidepressants, if we address the root cause, right? Is it a relationship? Is it the stress of school? Is it work? Is it, whatever it is, instead of actually taking the time and supporting that individual through whatever their life experience is, we're medicating them. And it's just perpetuating an issue that they have to deal with at 30, right? And then if they're on birth control at the same time on top of this, how many women are on birth control first and then end up on antidepressants because of the way that the birth control is changing their hormonal function and influencing their neurotransmitters? Do you know the data there? How many women on birth control end up on an antidepressant?
I don't know that statistic, but clinically I see it a lot. But oral contraceptive pills are kind of interesting because for some women, they'll say that, their PMS symptoms go down, they feel more emotionally stable. But some women say the opposite. They become more depressed and more irritable. I mean, there's huge variance in how this happens. And so I've seen people who get put on this, they become depressed. The doctor doesn't recognize that as the oral contraceptive pill. And then they get put on an SSRI for literally like no reason. I mean, the whole oral contraceptive pill thing, polypharmacy. I mean, this goes into a deeper issue about how we have structured our society and women need to feel like they're men now and they need to go and work and they can't have a period and they can't have these cycles throughout the month. And it's like, I have to be, a square in a round hole. And so now I need to eliminate my period by getting on these things. How unnatural is that? Like, what an awful thing to be doing to half of the population by making them feel this pressure that they need to, I would say, the stability of not having something that is incredibly natural. And so women suppress that with the pill and they end up with all of these problems later on.
Right. Yeah. And so we end up 15 years down the road, right? Like you said, wanting to have babies. And now we have to wean off the SSRI, our antidepressants. We have to get off the birth control. We have to reestablish a menstrual cycle because that hormonal pathway has been completely shut down, right? And I think it just kind of goes back to the message that the majority of society is sending to women, right, is to be more like men. And obviously we are in contrary to that. We want women to feel powerful in who they are in the way that I believe that God created them, right? And it's also natural for women to feel different at different times in their menstrual cycle based on how their hormones are fluctuating through the month, right? Is it common is not always normal, right? I think that we can very much agree on that. But is it normal for us to feel a little more sad or a little bit more testy days before our cycle starts? Well, yes, because estrogen is plummeting down, progesterone's coming up, right? That's a normal fluctuation. Now, we're not talking about like PMDD, raging PMS, that's a little bit more extreme, but just like a natural fluctuation in how we feel is normal. Is it normal for women to feel like they can slay a dragon when they're ovulating? Yes, absolutely. And I encourage the women that I work with to try to structure their life around their cycle, right? So that we can lean into that womanhood instead of trying to fight against it all the time.
Absolutely. And you're right. Yeah, I mean, it is absolutely normal for women to have these fluctuations, and gosh, it's protective in some ways as well. I mean, after you ovulate, women tend to shift into a more depressive phase because they're looking after a potential baby that's being grown. When they're about to ovulate, they, like you said, they want to slay a dragon, but they're also more sexually interested and all of those things. They feel more confident, they're more outgoing because that is the time when where it all happens. So it's it's normal.
Right. And in the recognition of that, right? And that's why we're here. That's why we're having this conversation, is to lay the foundation and remind women and men, whoever's listening, that God designed us uniquely, men and women differently, right? And we need to take that to our advantage. But I think another purpose of this conversation, even though you may be hearing some things that are difficult as you're listening, and I think you alluded to this a bit ago, Josef, in terms of women having children while they're on some of these medications, and that can feel a little bit triggering, right? But like, we need to be here having these conversations. That's why we are, quote unquote, prescribing the truth, because no one else is talking about it. So if we're not talking about it, where are people going to get their information from, right? Or where are they going to learn this? And this is part of us providing informed consent.
I mean, the rates of autism have just gone through the roof now. Like I can't remember. Like, is it 1 in 30 or something like? It might even be like higher than that.
I think it might be less.
Yeah. And so I think, and we've gone from this being like one in the thousands, 2,000, something like that. And we have to ask these questions. What the hell happened in the last 30 years? And well, Prozac entered the market in 1988. Like, maybe we should have a look at the fact that, 13% of pregnant women are on these medications. And I think we need to look at the fact that we, dose up moms with heaps of vaccines that have never been tested in combination together. And that I think it's almost like 90% of women have one pharmaceutical, like at least one pharmaceutical exposure during their pregnancy. And
wild.
It is uncomfortable to think about all of these things. But I think unless we start telling women the truth that, hey, by the way, none of these things are ever tested in pregnant women, not the vaccines, not, the psychiatric medications, that this is experimental, and people are misleading you about the fact that you are not in an experiment, because you are.
And technically, it's unethical to do research on pregnant women, right? Which is part of the reason that we don't have a ton of research on pregnant women, but you are by default, you are the research, unfortunately, by default. And I think that you bring such a valid point, or even something that I haven't considered much, Josef, to the conversation in terms of autism. I think, we're very much like, there's strong correlations between vaccines and autism. There's strong correlations between acetaminophen or Tylenol and autism. And truly, like, this idea of the psychiatric medications having an influence on autism is not even something that I've really put much thought behind before. And I don't think a lot of those of us that are kind of screaming from the rooftops about other things are considering that impact. And I just think that that's so valuable to bring to the forefront of the conversation as an additional layer, right? We're multifactorial, and there's not often just one cause.
Yeah. I mean, look at what's happening to the mice, placebo-controlled studies. One group of mice on SSRIs during when they were born, one group not. Changes in sexual and mating behavior, more depressive type behavior, changes in behavior described as being autistic-like, which persists. I mean, there is a signal in animals. There are findings in MRIs. And so to me, it's something very troubling. The other thing, this is something that I talk about, which really makes me think that I have, that I've got a tin hat on. And I think people look at me this way, but these drugs have potent effects on your sexual behavior. I mean, anyone who's taken them know that it blunts sexuality. And I wonder about the effects, about what's happened since, so many children are on these while they're developing, while they're going through puberty, either when they were children or when they were in utero. Because when I look around, I see large rates of, people identifying as asexual or LGBTQ. There's been a huge surge in this. I think some of it's social contagion. I think some of it is it's more acceptable. But I also worry about, what have we been doing the last 30 years? Are we causing changes in sexual behavior like we were seeing in the animals? Is this making people feel like, maybe I'm not the right gender? Maybe, why don't I feel attracted to the opposite sex? Is there something going on with my sexuality? Why don't I feel attracted to anyone at all? Am I asexual? I don't think anyone is really asking the questions of, well, what are the consequences of disrupting our serotonin system, our neurotransmitter system during these vital periods where the brain is developing?
Yeah, absolutely. And I think past development, we could continue on and say, what percentage of individuals in these communities, right, like the LGBTQ community, so on and so forth, are on these pharmaceuticals as well? And are the pharmaceuticals potentiating the discontent that they feel, feeling more depressed, more anxious? Do you know the percentage? What percentage of that population is?
Yeah.
It's high, yeah.
It's one of the highest rates that you see out there. It's in line with like veterans. I think veterans are around 30%. LGBTQ community is around 30% on antidepressants. And there was some really frightening data that actually was in the New York Times. It was about 2 years ago. They did a survey asking people in the LGBTQ community whether their sexual functioning returned after they got off antidepressants. And like 10% of them said it didn't. Now, this is like another part of this whole story, which we haven't touched on. And that is that recently, drug regulators have been acknowledging that antidepressants can cause persistent sexual dysfunction that does not go away. It was labeled in the European Union, in Canada, in Australia. When you have 10% of the LGBTQ community saying their sexual functioning was not normal again, even after they came off the medications, I mean, that is such a high proportion of that group of individuals that, to me, it's like, yes, there might be something going on with these drugs and their effect on sexual functioning that could be tied into their gender identity or their sexuality. I mean, it's 10% of people who are reporting severe, enduring sexual problems. And so we don't like having these topics. We don't like talking about these things, but we need to talk about them.
Absolutely. It might feel slimy or uncomfortable, but we have to ask these questions. We have to have these conversations out of a place of compassion to support people to live happier, healthier, more fulfilled lives, right? It doesn't always have to be negative to have these conversations. It can be from a place of concern.
Well, it's true. And I know these things are frightening, and I know the women who get put on these medications, they're having real legitimate problems, and no one should feel shame, if they have to take a medication. It's not black or white. It doesn't mean you never take a medication during pregnancy. It means that you need to be informed, and you need to know what you're walking into, and that you need to have been presented with alternatives that you could try. And if you've tried the other non-drug options, being informed of the risks, you can make that choice. And it is a reasonable choice for some people to make depending on the circumstances. And so we don't want to shame women who get on the medications or anything like that, but they deserve to know the truth, and they deserve to know what they're walking into so they can make the right decision for them.
Absolutely. As we kind of wrap things up here, I would love to spend a few minutes chatting with you about taper. So if people are listening, they've got their wheels spinning, now they're thinking, maybe I do really want to get off these medications. What's the first step? What do people do? How do they even start? I'll
send you some videos because it's a longer topic, but I have one. It's like how to taper off medications 2025 and how to find a doctor to help you taper. So I'm going to give you both of those videos. The short of it is do it from a place of stability, which might not be that hard for many women. They might have gotten on them from a stressor, like a breakup or a move or something that's now resolved. If the reason has now resolved, you can start peeling away the drug. Now, the main thing that I want to warn you about is that doctors will often tell you that you can come off in a couple of months. That's incredibly dangerous. Some people can, and they're fine, but I work with people when they do that, it turns their life upside down and they can get really badly hurt. And so the most important thing is to taper at a rate that your body is able to adapt to. When I work with people who've been on these medications for, I'd say, 3+ years, sometimes that can take you a year or two to come off if you're just doing it slowly. It's not something that you want to rush. And if you go to the Dr. Josef YouTube channel, we have a playlist. It's called Tapering Tips. And it will walk you through, in a lot of detail, everything that you need to know about coming off the medications in a safe way.
That's helpful. We'll make sure that those links are in the show notes. And I think, to reiterate, the most important thing that I'm hearing you say, I believe, is just having realistic expectations about the taper process and how long that's going to last, right? So if you are one of those women listening that are hoping to conceive soon, it reiterates the importance of working on the root cause, starting to taper these medications with your physician before you're ready to conceive the next cycle, right?
Yes.
Yeah. Absolutely. Well, thank you so much for being here and hanging out and having this wonderful conversation with me, Josef. I think we probably got a lot of wheels spinning for a lot of people today and covered a lot of different things. Dr. Josef, you are just such an incredible blessing to our community and to all the people that you serve, and we very much appreciate the work that you do. Any last things that you would like to share with those that are listening?
I can't think of anything, Nick. Just want to say thank you so much for inviting me on your platform and introducing me to your audience. If people want to learn more about me, then the Dr. Josef YouTube channels, that's Josef, the German spelling of Josef, and taperclinic.com is our practice. And so if you want to work with me or my team, I think we're in like the top 10 or top 13 most populous states in the United States. And if you're interested, we might be able to help.
Wonderful. Go find Dr. Josef, follow him on YouTube, reach out for his support. His team and him are amazing. So thanks again. I'd love to chat with you again soon, and we'll catch up soon.
Let's do it.
Thank you.
Take care.
Thanks for hanging out with me on today's episode of Prescribing the Truth. If you loved our chat, you can find me on all the socials. Come say hi on Instagram at dr.NicoleMorris. And don't forget, I drop exclusive content on YouTube every week, so be sure to subscribe so you don't miss out. Also, I've got to tell you, if you are in need of high-quality, research-backed supplements, check out shopdrmorris.com for my full line of third-party tested, USA-made products. My Prenatal Plus is top of the line for fertility support, and if you've got little ones, grab a bottle of Kids Complete too. Lastly, if you and your husband are trying to conceive naturally without IUI or IVF, my team and I would love to support you, pray with you, and walk this journey with you. Just head over to drnicolemorris.com. That's Dr. Nichole Morris, Nicole with an H, to book a preconception consultation with me. Thanks for joining me today. Stay informed and God bless.